Hi guys, so let's get started with osteoporosis today. So, if you remember, let's go back to the bone. So, where's the problem in osteoporosis? Well, you get back to the bone. Bone has osteoid, and bone also has minerals, right? Now, this forms osteon. So, what happens in osteoporosis is, because the first thing that you need to know is the most common reason or cause of osteoporosis is nothing but the age. As you grow older, the bones get weakened, and it's just not um, because of some problem. It's just the age. So because of the increasing age, you have decrease in number of cells and proteins, as well as decrease in number of minerals. So both osteoid, when we say osteoid, that contains bone cells, as well as proteins and plus minerals, both of these are decreased in case of osteoporosis, and therefore you have pain in your joints, and sometimes weight bearing is difficult, sometimes as well as you get fractures easily, right? So what I'm trying to say here about osteoporosis is that because both osteoid and minerals are less, that is why when you check in serum, the serum levels of minerals are usually normal. That means calcium or phosphate, they are usually normal. Okay, so this is a very important thing that can differentiate osteoporosis from other diseases like rickets, osteomalacia, let's say. So remember, in osteoporosis or Paget's disease, of course we can differentiate it from that too. In osteoporosis, serum levels of calcium are normal, or phosphate or minerals are normal. Okay, so let's go forward with osteoporosis. We've already seen the most common symptoms. The most common reason is basically senility. That means senile age, and it's usually common in postmenopausal women because, of course, we have estrogen that actually helps with building of bones. So postmenopausal, no estrogen, therefore osteoporosis is something that is bound to happen. Okay, so other than that, what else is important? Now we're just going to discuss important things along with understanding. Okay, so most common area or most common site that is affected in osteoporosis is very important. It starts with spine. So spine is the most commonly affected. Okay, then you have hips that are affected, and finally wrists that are affected. Okay, so in wrist you can actually see Colles fracture, that is most common. Okay, and in spine you usually see kyphosis. Okay, abnormal curvature of the spine. Okay, so these are the things that you need to remember about osteoporosis. So what is the most common site of osteoporosis? You have to remember is the most common one that is involved is spine, and then the next one are hips, and then finally wrist. Okay, apart from that, what is the symptom that a patient's going to present you with? So, of course, when spine is the most commonly involved site in osteoporosis, then definitely what will happen? Backache. So, these women usually present you with backache, that is the pain. So, pain is the earliest symptom in case of osteoporosis. Okay, so they're going to present you with backache. So these are some of the important points which we need to remember about osteoporosis. Okay, so what is it that you're going to do next in this patient? So the next investigation, so the patient's going to come, a female, 60 years old, comes to you with backache. Okay, right? You ask the history to the patient, she says there's nothing significant in her history. Okay, so the next thing that you're going to do in this case is, well, the next thing that you're going to do is you will do, of course, an x-ray. Okay, so an x-ray will be done in these cases, and usually you will see well we'll see codfish vertebra. Okay, So if you remember when we were talking about codfish vertebra in osteomalacia, there itself I told you that in osteomalacia you do see codfish vertebra, but it is most common in porosis. So osteoporosis is more common rather than osteomalacia. So let's see the picture of codfish vertebra. Now if you see here, well, what happens is because of let's say compression. What happens is that the compression, because you don't have enough minerals, so what happens is because of that the vertebra compresses, and the vertebra compresses into biconcave shape, and this biconcave shape looks as if the codfish, this is the codfish. Now this vertebra looks like codfish, and therefore some radiologists give this name as codfish to actually make our life more difficult, but it is fine because I have already emphasized more than enough times that codfish vertebra is seen in osteoporosis more than osteomalacia, right? Now there is one more thing that we need to understand here is usually codfish vertebra can be present all over the all like along the spine completely, so all over the spine, so in all the areas of the spine, but it's mostly seen in lumbar region. Why in lumbar region? Well, because lumbar region would be carrying the most of the weight of a person. So codfish vertebra can mostly be seen in the lumbar region, but it can also be seen along the whole curvature of spine. Okay, now apart from that, what is the next thing that you're going to do? Okay, sometimes, well, codfish vertebra is very specific, right? So not in all patients you're going to see codfish vertebra. Definitely you're going to order x-ray of the areas that she's complaining about, but you need to confirm this. So what is the investigation of choice in case of osteoporosis? This is very, very important. We usually check the bone mineral density. We check the bone density, and like how much density does the bone have. So this bone density or bone mineral density is actually checked by a special investigation that is called as DEXA scan. Okay, so what is this? Dual energy X-ray absorption technique, and this is routinely done in females over 65 years of age and males over 70 years of age. Okay, so remember we do the DEXA scan. Now what we're going to do in this DEXA scan is, after doing the DEXA scan, we're going to measure the bone density by scoring the density. So this score is actually taken in reference to a young healthy person, with the young healthy person. Okay, so if you take, so let's say, and this score is called as T score. Okay, so T score is actually a score that has a reference value and a score that is given to the patient. Okay, so the reference value which is taken from the T score is actually from a young, healthy individual. They might not be of same age, of course, because they are young, but they will be healthy, male or female, depending upon who your patient is. So if the patient is female, then we're going to check the reference for the young healthy female. So now we measure this in standard deviations. Okay, so the T score is measured in standard deviation. So this point is very, very important. So you need to know like what standard deviation is considered normal. So if it is 0 to -1 standard deviation, then this is considered as normal. If it is -1 to -2.5 standard deviations, then this is considered that now it's the medial range where the bone is getting resorbed, you can say. So osteopenia. So this is the stage of, penia means less, osteo means bone. So this is a stage where the bone is less. Now, after well, we say less than minus 2.5, but we are actually referring to above 2.5, right? So minus 2.6, minus 2.7. So above minus 2.5, we consider this stage as osteoporosis. This is very important because this is something that is actually given in exams, that the DEXA scan shows the t-score of 2.6 or 3 or minus 3, right? So this is something that helps you confirm the diagnosis of osteoporosis. Okay, now after this, what is another thing that's more important is as well as the treatment. The treatment is very important in this case. So what we can do in osteoporosis is, well, we can actually help the bone formation. Okay, so we can help with the bone formation, we can increase the bone formation, or we can decrease the bone resorption. We can decrease the bone resorption, or we can give a drug which can do both, that is bone formation and decrease the bone resorption. Or in other cases where it's needed, we can also do surgeries. Okay, so we're gonna, the most important ones are bone resorption, bone formation, and what are the drugs that do both. So let's briefly talk about all these drugs. So bone resorption is decreased by a drug called as bisphosphonates, and bisphosphonates are the drug of choice in cases of bisphosphonates. Okay, in cases of osteoporosis. So remember, the drug of choice in case of osteoporosis is bisphosphonates. And how do they function? They actually decrease the activity of osteoclasts. Okay, so they help with decreasing the activity. Let's take some of the examples of bisphosphonates. We have alendronate here. So we usually give alendronate, and now there is a controversy here that how long can we give alendronate for? Well, some people mention that, or some books mention that you should give it for 5 years, and then you should stop it for 1 to 2 years, and then start again. So in these 1 to 2 years, we can give other drugs. Okay, so, and why do we do this? Because if you give this long term, alendronate can actually lead to osteoporosis. Now understand this, if we are giving a drug to treat osteoporosis, we don't want osteoporosis to happen. So when this drug is given for long term, then it has a long term complication of osteoporosis, and therefore we stop this drug after 5 years, give another drug for 1 to 2 years, and then start this drug back again. Okay. Now other thing that we that's important, yeah. So why is it a controversy? Because well, in some other places it mentions that you should give it for 2 years and then stop it, and then of course started after giving the drugs. So this is something that is controversial. So whatever is best for you, you can learn that, and whatever you think can be best in clinical practice, you can learn that. Okay, now there is a special way that you give bisphosphonates. You have to tell the patient. You have to tell the patient that when you take this tablet, which is usually given every week, so like every week or weekend, whatever. So usually a weekly tablet, and when you give this tablet, you say to the patient that that when you take this tablet, it's important that you sit up straight. Okay, take it with water, not with anything else. Don't take it with milk. No, don't take it with milk. You sit up straight for that time, or walk. Do not lie down. Do not lie down. Why do not lie down? Because bisphosphonates have a very important side effect, that when it comes in contact with esophageal or any mucous membrane, so esophageal membrane, let's say, so esophagus, the outer layer of esophagus, what will happen is it can actually perforate it, and we don't want it. But when it goes into the stomach, well, we have stomach acids that can help in digestion, that can help in, of course, sorry, not digestion, the absorption of bisphosphonate. So stomach is protected because it has acid, but esophagus is not protected. So bisphosphonates should not stick to the esophageal wall because it can cause perforation, and therefore that is why we ask the patients to sit up straight for 30 minutes after you've taken the tablet, for at least 30 minutes after you've taken the tablet. Okay, do not lie down. Okay, okay, so after that we have other drugs that can actually lead to decrease in bone resorption. Increase in bone Yeah. We have to decrease the bone resorption, right? So decrease in bone resorption, the first one we saw was bisphosphonates, which is also a drug of choice in these cases. So bisphosphonates, which is also a drug of choice. The other one is denosumab. Now, if you remember, I think I might have mentioned this in my class when I was talking about the, I guess, histology or structure or physiology of the bone. That denosumab is a monoclonal antibody that actually inhibits the rank ligands, right? So it inhibits the rank ligands, and when it inhibits the rank ligands, it prevents the formation of osteoclasts, okay? And when osteoclast is not formed, then of course bone resorption is not going to take place. The other ones are selective estrogen receptor modulators, SERM, and an example of this is raloxifene. And you can also consider giving HRT, hormone replacement therapy for postmenopausal women. We also have something called as calcitonin in this category that is usually given as nasal spray. Both of them, all of these will actually decrease the resorption of the bone and helps in formation basically. So indirectly leading to bone formation. The other ones that increase the bone formation are, well, this is very, very important. This is a recombinant PTH, that is PTH analog, and this is teriparatide. Again, teriparatide. Another one almost similar is abaloparatide. Okay, abaloparatide. So these paratides you have to remember, these are PTH analogs. So remember these. Paratide, that is parathyroid hormone like function. So teri and abalo. So teriparatide and abaloparatide. Apart from that, you can also give calcium directly for bone formation, and this calcium is usually given 1200 milligrams. You can also say 1300 milligrams per day, because in exam they have asked like if 1300 is a dose, then you can say yes, because it is near to 1200. You can give 1300 milligrams per day of calcium in these patients. Now, what is a drug that can actually help with both bone formation and decrease bone resorption? This is also important. This is a drug called as strontium ranelate. So strontium ranelate is a drug that actually does both. Okay. Well, the surgeries are not important, but let me just briefly discuss these surgeries as well. These are known as vertebroplasty and balloon kyphoplasty. Okay, vertebroplasty. So what you will do in these surgeries is basically there is something called as polymethyl mecrylate, PMMC, polymethyl metacrylate, which actually is filled up in these vertebrae, which we call as vertebroplasty, not blasty, it's vertebroplasty. And when it is filled up in a form of balloon, then we call it balloon kyphoplasty. Okay, balloon kyphoplasty. So remember these. Well, these are not very important. The important things are these drugs that we give in the case of osteoporosis. I'm just going to brief it all down. So we discussed osteoporosis, what actually happens, and serum calcium levels are normal. Who are the most common people who are predisposed to osteoporosis? We saw the most common site is spine, and that is why the earliest symptom that the patient presents us is with backache. So the first thing that you're going to do in these patients is X-ray, and in X-ray we see codfish vertebra. We can also see impaction or compression of the vertebra, and then we see what is the investigation of choice. The next thing that we do in these patients is the DEXA scan, in which we do the T-scoring, and if the T-scoring is less than minus 2.5, then we call it osteoporosis. Okay, and the drug of choice in osteoporosis is bisphosphonates. We can give some drugs that can help with decrease in bone resorption. We can also give some drugs that can help with increasing in bone formation, and as well as do both of them and some of the surgeries that can be done in these cases. Okay, so that's all about osteoporosis in my video. In the next video, we will talk about another bone disease, and it's gonna be awesome. Okay guys, so I'll see you in my next video. Have fun and take care. Bye bye.